John was a firefighter, and with Forestry Service, and a 9/11 operator dispatcher. I'm just looking over his little bio here, and he's been a registered nurse in the emergency department, and now he is our burn outreach and disaster coordinator. And all of this is very timely because it is burn prevention and treatment week. This is burn week. So we're just really delighted to have John partner with us, and I think that we're going to be doing a lot more things together. We've been working with some of the researchers and are happy here to answer any questions or refer you to the appropriate person over in the burn unit. Okay, so John, here you go.
Thank you very much. Thank you, Judy and Barbara. I'd like to thank you guys for having me come down here. If you guys don't know, this is the Patient Resource Center. So Myra Mahone Patient Resource Center, and so this is where patients and even doctors and clinicians can come and get more information, diabetes and cancer and burn stuff, and pretty much you can see all the flyers and pamphlets. They are quite knowledgeable and can get you information about anything. So if you ever have any questions that maybe your doctor can't answer, or you maybe don't want to call the doctor, try down here. It's great, and they have computers you can use and study, so really appreciate this opportunity, and I appreciate you guys coming down to learn. Let me get started. This is actually Fire Prevention Week, and so that's why I'm doing this. Burn Awareness Week comes up in February, but this is Fire Prevention Week. National Fire Protection Agency, they always do a big Fire Prevention Week every year, so I figured this would be a great time to talk about some burns. Burn prevention. Do have to warn you, sometimes, we do have to show some pictures, and not everybody is accustomed to seeing burns every day like I do. They are a wound, it's a skin wound, but I feel it's important to show you some pictures just so you can kind of identify the different burns. Nothing too graphic. This isn't a clinician lecture, this is more of a community lecture, so I've kind of tamed it down a bit. So again, it's Fire Prevention Week. This is recognized because of the Great Chicago Fire, October 8th and 10th. 1871. This was a fire that devastated Chicago, killed 300 people. It destroyed about 3.5 square miles of the city, left 100,000 homeless. This is back when they were building all in wood. Wasn't a whole lot of brick structures, so a major portion of that city was destroyed. Come on in, ma'am. Yes, have a seat. Thank you. Always want to just talk about fire safety. A couple of good things that I pulled off of the NFPA site. Plan your escape route. Let's think when you go home or when you're in a building like this, how are you going to get out of here? If there is a fire, look for those fire exits. Kind of think that if you're in a big crowded space, probably everybody's going to go out the same entrance they came in. So always look for, if it's me, I'm always looking for that exit where not too many people are going to be knowing about. Maybe it's kind of hidden a little bit, or they're going to see that. Maybe I'll have a better chance to escape with my family. I can bring some other people out that way, because crowd mentality is to kind of go out that same way. So that exit or that entrance can get blocked up really quick. That's how people die in these fires. Test your smoke alarms. If you still have, they're making smoke alarms now that have lithium batteries in them, and so they'll last for 5 to 10 years. And you don't even, basically after the 5 years is up, it'll beep and it's time to get a new smoke alarm, so you just replace the whole thing. But a lot of us still have the smoke detectors with the 9-volt batteries in them, so it's always a good thing. I always say check it on your birthday. Sometimes they say check them when it's, changing of the clocks every year. When we're turning our clocks back, that's a good time to just press that test button and make sure it still works. Maybe take a little vacuum it out as well. Figure out where you're going to meet your family when you leave. Your home, your building. If you have to evacuate, kind of have that plan, especially if you have little kids. Tell the kids, come on kids, we're going to go meet over at the big tree across the street. That's the best place. So, there's going to be a crowd of people, there'll be fire trucks everywhere if there is a big fire. So you want to make sure your kids are safe, because the last thing you want to do is run back in there. We're going to leave that for the firefighters. You never go back in a place that is on fire. Practice your home fire drill. Figure out where your windows are, how you're going to escape your house, your apartment building, where the stairwells are. And get a fire extinguisher. How many in here have a fire extinguisher? All right, good. I see a few of us. So fire extinguishers are cheap. I brought a little one. Where is it? Let's see. It's right here. Look at this one. This is a fire extinguisher. This you can fit right in your, right next to your stove. You don't want to put it above the stove in that cabinet, because if the stove is on fire, how are you going to get it? But this is a really small one. Now, this is just going to put out like a frying pan or a little waste paper basket. This isn't something, if your couch catches on fire, this is not going to put it out. If it does spread up into the cabinets, then you're going to want to call 911 and get everybody out. And if you do have to evacuate, then shut the door behind you. But fire extinguishers, they come in all different sizes, and most of them only last about 20 to 30 seconds. So just remember that. This isn't something where you're going to put out a whole car fire, your house on fire. Leave that up to the fire department. This is basically just if you see some smoke coming out of, maybe we throw a cigarette butt or something into a trash can and you see it smoking, that's a good opportunity to use that fire extinguisher. And I don't know if anybody knows a proper way of using a fire extinguisher, but usually there's a little pin in it, and they always have the acronym PASS, P-A-S-S, where you're going to pull that pin, you're going to aim the hose, you're going to squeeze that handle, and you're going to sweep side to side. And that's just something that, kind of a nice little acronym we can remember, PASS, P-A-S-S. So you pull, aim, squeeze the handle, and then sweep from side to side. And you're aiming at the base of those flames to put that out. And then also get to know your neighbors. This is something, I kind of added that in because if you're in your apartment building and maybe somebody next to you is blind or deaf or maybe on oxygen or maybe they would have trouble getting down the stairs, you kind of want to know. So you know if there is a fire, you need to bang on their door and help them get out. So very important, just some little tips. Hi, welcome, come on in. And I do have some flyers and brochures and bags and all kinds of stuff back there, so feel free to take anything you'd like. And there's some nice little water bottles too. So let's talk about what's burning people. As I said, I work over in the burn center. As you can see here, these are national statistics. 41% of the burns are coming from fire and flame. 33% are scald burns. Now in New York City, that's flipped, where scald burns are actually more prevalent. We're getting more scald burns, and because we have such a great fire department and they can be at your door in 2 minutes, less people are getting burned now by fire and flame. But imagine all those scald burns. I mean, you could go into the bodega and getting this coffee that's 200 degrees, or little kids reaching up onto the stove. We're seeing that on a daily basis. So we'll talk a little bit more about how to prevent that stuff. If I do go back to this, though, you do see still we have to worry about electrical burns, 3% electrical burns, even radiation, that still causes a burn. And that's not just the sun either, that can be cancer treatments when they're doing focused radiation on getting rid of breast tumors or any tumors around the body. Sometimes that can leave a deep burn that takes a long time to heal. And since we're skin experts at the burn center, we actually treat those injuries as well and help people get through those. So who's getting burned? As you can see from this graphic, the dark blue is men, the light blue is women. So look at that, it's guys like me, 20 to 50 years old. We're the ones out there playing with fire, adding gasoline to the barbecue grills, just no common sense. So the guys are getting burned. You've seen the YouTube videos. Luckily, women are a lot smarter than that. But you can see that, still, look at on the far left, we have infants getting burned all the way up to 80 years old and above. Still people getting burned every day. So you think your home is safe? You look at this graphic, that big pie chart there, that dark area, that's your home. 75% of the burns that we see across the nation, this is a national statistic, all those burns are happening in the home. So I'm going to talk to you a little bit about how to burn-proof your home. But they still happen, on the job, when you're outdoors doing stuff. So just kind of have that in your mind. And this is why I'm giving the presentation today, so we can kind of think about that, because it's not like we think about burns on a daily basis. Myself, I do. Everybody at the burn center, we do as well. So let's continue. So burn prevention. Look at some of these things that can burn you. So I am from Arizona, moved out here about 6 years ago. When everybody talked about getting burned by a radiator, I thought it was this thing up here in the right-hand corner, right? The radiator steaming and you would get a bad burn. Well, I move out here to New York and you have these gigantic hunks of metal, these iron things sitting in your living room that get super hot. Little kid will touch that and they'll get a contact burn. You can rub against it with your thigh, you'll get a burn. That's a radiator burn now. You look at that fireplace, looks beautiful, nice glass front. Little kids love running up there and putting their hands right on that, and they get really bad burns. So maybe have like something blocking that fireplace, or put a heat-proof piece of glass up there. Fireworks, people smoking cigarettes while using oxygen. We have seen some fires start because of that. We're seeing a lot of the e-cigarette lithium battery burns. hot tea, fireworks, hot coffee. Look at that electrical cord. Time to get rid of that electrical cord. We see a lot of injuries where people have these old electrical cords that they've had for 20, 25 years, and they go to grab it, and the cat's maybe even chewing on it or something, and they grab it, and all of a sudden they get shocked and they'll get a bad burn in their hand. So be careful. Get rid of that cord. Get a new one. They're $5, very cheap. These are radiator covers. So you can see how this will help protect you from getting burned. This will help your little kids, your grandkids from getting burned. It looks nice. You can decorate it up, and it's not going to block all the heat. You're still going to heat up the room, but it's a nice way to protect people from getting burned against that. Those blankets in the middle, those are also radiator blankets. You can throw that blanket over when you have guests and maybe take it off, or when you have the grandkids over or something, throw that blanket up there. It's just going to help prevent the burns. The best thing we can do is prevention. So we want to prevent scalds. This is from the ABA, from the American Burn Association website. We want to keep children 3 feet away from the stove. Have a little no kid zone. Maybe put some tape down there, or teach these kids to stay away from the stove. Obviously, we know the 2 and 3-year-olds, they just love to run around everywhere, and they're going to climb on everything. And we all know to turn the pot handles inwards, and we've heard all that stuff. But still, on a daily basis, we see these children that reach up and grab these items off the stove. Or they'll grab mom's coffee or something sitting up on a coffee table. Same thing with popcorn. How many times you open that bag of popcorn and you're getting the steam burns up your hands? So be very careful. Set your water heater to 120 degrees. Turn it down. Not only is this going to save you money and electricity, but it's also going to help people from getting burned. Because imagine all those times that you're maybe taking a shower, a bath, and water's running, somebody flushes the toilet, and all of a sudden now it's just hot water coming out of there. Sometimes now that doesn't happen so much because of these newer buildings. They have some building codes in the plumbing that prevent that, but still it can happen. One thing that I tell people all the time is about, and something that my boss told me on my first day was never bathe the baby in the sink. We see a lot of these injuries where mom is, bathing the baby, mom or dad, they're bathing the baby in the sink, baby kicks off that cold water tap, and now it's just hot, scalding water coming out of there. And sometimes you'll go into these buildings, residential buildings, commercial buildings, you're going to wash your hands and it's just super hot water. Imagine that on a baby's skin. I have a graphic I'll show you in a little bit later that talks about how quickly babies can get burned. Look at that, I never thought tap water could get that hot, and that is from a burn injury. So if you turn down your water heater to 120, that's never going to happen because it can't get hot enough to burn you. And again, preventing scalds, so fill the tub, run your hand through the water to test for hot spots. You can even use your elbow, dip your elbow in there. If it's too hot for your elbow, it's too hot for that child. And then you help the child get in and make sure they're not sitting there playing with the taps. And of course, you never leave a child in the bathtub alone for drowning, but also for the same reason, you don't want them playing with those tap water and scalding themselves. This is a new one here. This is something that we're seeing now. There's a thing going on in the internet. It's the alcohol challenge, the burn challenge, and this is where kids will take rubbing alcohol and they pour it all over themselves and then they light it on fire. I know. I am like, what are you thinking? But this is all over YouTube, and you know how kids are. They'll see something and they want to imitate it. So I just show this to people to make them aware of this stuff. Maybe lock up that rubbing alcohol if you have it, or try to prevent them from doing this stuff. But people are dying from this, and it's completely preventable. So let's talk about prevention. Back in the 1970s, there was 300 deaths per year in New York City. That was back when the Bronx was burning, building fires, and fire department was running like crazy all over this city. Well, now due to fire prevention efforts and really good education, now those deaths are coming down. In 2016, it was down to 48 deaths. 2017, I think there was about 60. So it went up a little bit, but we would like to get it down to 0, right? 1 death from a fire is too much. So let's talk about the burn center. You guys are very lucky. You have one of the best burn centers in the world right across the street. We're at NewYork-Presbyterian Weill Cornell. We're on the 8th floor. That is our burn ICU. On the 7th floor, we have an outpatient burn clinic. It is an amazing team of doctors and nurses and everybody that works over there. I am proud to work over there. If anybody in my family ever got burned, I would send them straight there. That says a lot about the place you work at. We're one of the biggest and busiest in the country. We treat more than 700 to 800 patients a year in our ICU. We treat about 4,000 people outpatient basis in our outpatient clinic. And that's mostly for like the minor burn. So if you do get a minor burn, you can always come to the outpatient clinic. You don't necessarily have to be in the hospital for days and days. We are the only verified burn center by the American Burn Association. So that means that they come every 3 years. They make sure that we're up on all our quality, our education, our outreach efforts, all of our prevention activities. It's almost like magnet status for the burn center. So it is quite a verification. There's actually 4 burn centers in New York City. There's one in Staten Island, one in Bronx, one in Harlem, and then this one here. But again, we're the only ABA verified burn center, and we are super busy. We run all the time. It's a 20-bed adult and pediatric ICU, and then we also have areas where we can put people in other areas of the hospital. And again, when you think about a burn center, it's not just the surgeons and the nurses that make this happen. It's an entire team. We have psychiatry. Imagine the psychology that goes into a burn. We have social workers, case managers, people that help people find homes after their burn. Maybe you were in a bad house fire, your house is gone. Maybe your family member is gone. Maybe your job is gone. How are these people going to return back to life? So this is the kind of center where it's not like we just discharge you and you're out the door and you got to find your own way. We actually help people. We'll keep following for years just to make sure, keep in touch with them to make sure they're doing okay. Because a burn is, it's not like a leg where you break it, we fix it, and then you go back to work and on with your life. A burn can be a devastating injury that can last for years, many, many years. We also have a skin bank there. It's amazing. We'll actually go and preserve skin. We'll take skin off cadavers. We use that for our grafting. We have child life specialists. Nutrition is a huge thing in burns. It takes a lot of nutrition and good nutrition basically to heal from these burns. So we have people that specialize in that. We have a chaplain, an outreach person, quality, and it's not just these thermal burns, contact burns that we treat, but we treat all different kinds of things. Frostbite, we'll talk a little bit about that. Stevens-Johnson syndrome. We have a couple nursing students here, so they're going to learn about Stevens-Johnson's. That's an allergic reaction where the body has this reaction to maybe a sulfa drug or some IV medication and just starts sloughing the skin, an autoimmune reaction. Yes, ma'am.
Also, I wanted to mention my daughter has been across the street for almost 10 months. She didn't have a burn. She did have the flu. She got the flu. But she developed a very bad head sore, which osteomyelitis, and the burn team came with big people and constantly kept on top of her. And now that big huge thing like this is tiny, and they were almost talking about skin grafting and all that. They were amazing. So from
Thank you so much. What a
I
good
have to
testimony.
say,
Thank you.
Yes, amazing.
Wow, that just gave me chills. That's great to hear. We appreciate that. Yeah. So again, right? Skin disorders. We are skin experts over there. So we deal. Unfortunately, some people, if they're laying in bed for a long time, that skin will break down. Becomes macerated, and a lot of times there's not a whole lot you can do about it to prevent it. We try all different kinds of pads, but sometimes that skin does break down, so it does take some skin experts to heal that. So I'm glad that she is doing a lot better. It's good to hear. Electrical injuries. We even have a hyperbaric chamber over there, so we'll treat the bends, and that comes from diving accidents. That's where if divers come up too quick, they get some nitrogen in their bones. But we have a big hyperbaric chamber. I have a picture of that I'll show you. And we'll put people in that hyperbaric chamber for about 2 to 3 hours. That also helps skin injuries as well, because they've done research showing that if you can hyperoxygenate that wound, give more oxygen to it, then it will heal a little bit faster and you'll have a better outcome. So that's kind of cool to see. These guys are some of our biggest supporters right here. The New York Firefighter Burn Center Foundation. They're huge. They help send all of our nurses and our staff to different burn conferences. They'll actually pay for the burn garments. I have some of these. Abroad, you may have seen people wearing these types of garments, this like spandex material. This stuff's very expensive. Now everybody wears it to go to the gym, but it used to be that you see people wearing this spandex and they wear it for 23 hours a day for years sometimes. The only time you take it off is the shower. And what this does, these are compression garments, and it compresses on that burn scar, because if you don't compress on it, it will keep growing and growing and growing like vertically. And so if you can compress it, it'll kind of keep those cells, tame those cells a little bit and keep them from growing up so much. But these are very expensive garments, and the foundation, they raise money for us on a daily basis, and so they're able to help provide those burn garments for us. We also make these little things out of plaster here, I have all kinds of different things if you guys want to see any of them, dressings. But these are huge supporters of us, and they actually helped found the burn center. If you guys remember this picture, this is an old picture from the AP News back in Vietnam. This is this young lady, her name is Kim Fuchs, and she was burned after the Americans went in and napalmed the village there. And this AP News photographer was standing there and watching as they came running out, and he actually took his bottle of water and started pouring it right on her, and probably ended up saving her life because she is still alive today. So the firefighters here in New York City, these two guys, Joe Hickey and Jack Mara, were sitting in the fire department in the firehouse. They see this front page and they go, we need to bring this girl here, get her some good burn care. They figure it out. This is 1973. There is no burn center in New York City. So what they did is they started collecting money from all the firefighters. They got a little tin can in every firehouse, and they said, put in $1 before every meal. Well, they raised a bunch of money, like 80 grand, and they ended up founding this burn center here. We were able to open, and originally it was called the New York Hospital. Now it's NewYork-Presbyterian Hospital. So these guys are huge supporters of us. They're always out doing all kinds of activities. We bring Santa here. We'll bring the Easter Bunny for the kids. You might see the bagpipers out and about. That is on the left there. That's Billy Leahy. He is the lieutenant of the fire department. He's also the president of the foundation. And then on the right, that is Dr. Gallagher. He's the director of the burn center. But yeah, they're always out. We'll be at the marathon. We were just at the Tunnel to Towers run, handing out water. We'll be at the marathon selling T-shirts and sweatshirts and hats. So if you ever see these guys out there, buy a hat. Just know that all your money, 100% of it's going to the burn center, and you may end up purchasing a burn garment for somebody one of these days. So let's talk about burns. We've all kind of seen this picture. This is your skin. You have 3 layers, basically. I know there's a lot of information up here, but you have 3 layers. You have that top layer is the epidermis. You have this middle layer is the dermis, and then you have the third layer, that's the subcutaneous layer. That's your fat layer. That's where all the fat cells are. But you can kind of see where the hair goes down deep. All the blood vessels are in the dermis area, your nerve endings. So that's going to come in on this next picture here, because you see over here on the left, that shows the different degrees of burns. So the first degree burn, that's like your sunburn, not too deep. It's just kind of affecting the epidermis layer. Your hair is still intact. It's very painful because your nerves are all still intact. The second degree burn, that's where it kind of bubbles up and you see that blister. Now you're separating those skin layers and it's starting to get some fluid in there. And then the third degree burn, that's the one we definitely don't want. That's where it's charred and now those nerve endings are destroyed. You're not feeling any pain. That's a very bad, deep burn. Again, this is a first degree burn. It's a sunburn. People aren't going to go to the burn center just for a sunburn. I'm from Phoenix. I had sunburns all the time when I was a kid. I'm healthy. I'm fine. That's just, we want to avoid that. We want to stay indoors if we can. It's going to be painful. You never want to pop these blisters. Just let them do their own thing. You never want to pop them because you can cause an infection by doing that. So this is how we prevent those. We stay out of the sun. There's 2 different types of radiation coming from the sun. There's UVA and UVB. So you want to find a sunscreen that prevents both of those. I always recommend an SPF 30 at least. Up there it says at least 15, but 30 to 50 is ideal. Anything over 50 or 60, they say, you're just kind of wasting your money. SPF, you can go buy an SPF 1000, but pretty much anything over SPF 60, it's just, it's really incremental on how much better it helps you out. But reapply it every 2 hours, especially if you're sweating or swimming. You want to try to, get rid of your expired sunscreen. If you have something that's been in there for 10 years, just get rid of it, go buy a new bottle. Don't forget your ears, your hands, all those little exposed areas. Wear sunglasses, wear a hat, and of course drink plenty of water, stay in the shade. So now a little more gruesome photo, but this is a second degree burn. So now you can see that top layer, that epidermis layer has been burnt off. You're going to get some more of this blistering. This is really bad blistering right here. And you don't want to pop those blisters. That's good fluid. That is, it's full of prostaglandins and mediators and all kinds of different big words and stuff that I don't even know. But it does all this really nice stuff in there, and that's the body's own way of protecting itself. It's like a dressing. So if you pop that, you're getting rid of all that fluid, And then you're also going to cause a little route for infection, for bacteria to get in there. So just let those blisters stay by themselves. If you have a burn like this, probably need to go to the burn center and get it checked out. Something up there, any of these burns, you should probably go to the burn center. So me, being the burn outreach guy, actually got burned last week. I have a little burn right here on my ankle when I was grilling, and my friend set down the hot grill lid right behind me, and I turned around and goes, "Ooh, wow, that was hot." And just for a second, but it's just a small little burn. It did blister. I put a little Vaseline on it. It's fine. It's going to heal just fine. We've all gotten those burns probably from cooking and things like that. So, but yeah, I'm the burn outreach guy, and I got a burn. So everybody's making fun of me at work now. But these can be really intense pain. It can take up to 2-3 weeks for these things to heal. If you're questioning if it's a large burn like this, you should go to the burn center. These little tiny things, yeah, you can use a little bacitracin or maybe some tea tree oil. My boss, she swears by tea tree oil. But anything bigger than that, you should probably get it checked out. And like I said, we have an outpatient burn clinic where you can come and talk to a doctor, talk to a surgeon. They'll let you know. So this is a 3rd degree burn. Now you can see that it's a very deep burn. This white part here, you can touch on that and they won't feel any pain. You can actually pull the hair out of the skin because the hair is destroyed. There's no circulation. You can touch on it. It's not going to blanch. This is a very bad burn. All of this stuff is going to have to be cut out. If we don't cut that out, the skin will die and the patient will become septic, and it's not, the patient could actually end up dying. So these are very serious burns. Any sort of 3rd degree burn, they definitely need to go to a burn center. So let's talk about these little scald burns. You can see the kid reaching up there on the stove. This is a baby that maybe was trying to drink hot water or grab something, and you can just see the burn pattern running right down the chest. Hot water, coffee, soup. Soup is a big one. And the thicker the soup is, the hotter it is. So clam chowder is going to be a worse burn than some chicken noodle soup. It's really bad, some of these burns, and a lot of this stuff is preventable, especially the bathtub and the shower ones. If they just turn down the water heater, talk to your landlord if you're in a big building where they just have one boiler. If you're in a single family house or a single family apartment, I have a water heater in my apartment. I turned it down. You can just take the little cover off, and there should be a little dial in there, and you can just turn it right back down. Because look at this graphic right here. If you want to take a photo, go right ahead. So you can see up there about 100 degrees, that's safe for bathing. 120 can still get a burn if you're in that, how many times you sit in that jacuzzi that's 120 degrees and you get out and there's just a big red line, it's pretty hot. So I like that, but, we need to be careful, because where is the thinnest skin on your body? It's your eyelids. Your eyelids are some of your thinnest skin in your body, and so you can imagine taking some hot water that's 150 degrees and dropping that on your eyelid, how bad it would hurt, and it might scab up. Well, a baby's skin is that thick, it's that thin all the way around their body. It's like tissue paper. So very dangerous if we have water that's 155 degrees. You can see right here, approximate time for a 3rd degree burn at 155 degrees is 1 second. Instantly a baby will get a 3rd degree burn at 180 degrees. And we know as we age, our skin is also thinner as well. So we're talking infants and the elderly, very dangerous. So again, just another reason to turn that water heater down and to watch our kids around water. So these are contact burns. Again, radiators, heat pipes, the oven door, the fireplace, muffler, playground apparatus. Back in Phoenix, it was 120 degrees all summer. You'd have kids like on this metal slide, or you're trying to buckle your seatbelt or touch your dashboard, you'd get a 3rd degree burn. It was crazy. It's so hot. That's why I moved. But now I'm out here where it's just humid all the time and I don't stop sweating, so I don't get it. Frostbite, that's a burn. This graphic, a lot of info here, but this just kind of shows that it's not just the temperature that will cause that burn, but also the wind. So if it's cold outside and the wind is blowing on your skin that is not covered, it's very prone to get frostbite. And we have plenty of people that we'll see all winter long that do have frostbite, and that's a burn. And some of these people, they'll stay in the burn unit for maybe 2-3 weeks, sometimes 3 months. It's a long time. It's not just a couple days and you're in and out. Some of these people have multiple surgeries, these burn survivors that we get. So this is burn surgery. This is what it is. Basically, if you have to have burn surgery, you'll go into the OR. This is all in surgery. It's all very sterile, but they'll basically take what looks like a razor, and you're under anesthesia, and they will scrape some skin off, and usually they take it from your hips or your back or your butt or the top of your head or somewhere where they can harvest this skin. They'll put it through this thing called a mesher. The mesher pokes a bunch of holes in it, so it kind of turns it into fishnet, sort of. So that way they can take a piece of skin that's this big, and then they can spread it out to where it's this big, and it'll cover the chest, so they only have to take 1 or 2 pieces of skin. But they'll put that right on, and they'll kind of suture it down, staple it down. This is a grafted partial thickness burn, so kind of a 2nd degree burn, like a deep second. But they'll staple that down and let it sit there and heal for about a week or 2. There's 2 different types of graft. There's autograft, which means they take that graft from you, and then there's allograft, which means they take it from a cadaver. So technically, if you're an organ donor, your skin is an organ, and we could technically go donate skin, but it's just very painful. It takes a long time to heal. You could get infected, so we only take it from cadavers, from people that have died. But if you're an organ donor, you can donate your skin. So as soon as you pass on, you're able to pass on your skin as well and help people. Because, like I said, we have a skin bank, and so we'll send a team out, and they'll harvest that skin, keep it in liquid nitrogen up on the 23rd floor of this hospital in the big skin bank. And then when you go to surgery, the doctor will say, I need 2 or 3 pieces of skin. They'll bring that skin down, they'll mesh it, and they'll put it right on. Yes, ma'am?
Does skin have to be typed the way blood
It
is?
does.
And
Yeah, there's all
bone
kinds.
marrow?
There's a whole list of things, say if it's a drowning and the person drowned in clear water, then that's okay. But if they drown in a pond, sorry, you can't donate skin because it could cause some infection or
But
fungus
she could
later.
donate to me without any testing.
Absolutely, and we try to color match the skin as well. Not without any testing. Everything has to be tested. So somebody with a chronic disease, they can't donate. Somebody with HIV or some
Okay.
major sort of diseases, they can't either. So there's a lot of things. We have experts up there that they'll look at the entire chart. And they have to do this within 24 hours, so it is kind of a time crunch. And but they'll send people to nursing homes, to ERs, wherever to harvest this skin. But they'll end up taking a lot of pieces.
But
of
it's not
skin
like
as well.
O negative or AB positive.
Sometimes
blood.
it is, yeah.
Oh,
We'll
okay.
type and cross match that. Yeah,
Okay.
absolutely.
Thank you.
Good question though, yeah. So these are the donor sites. Like I said, they'll take those little strips of skin from the hip, but they heal pretty quick. It's just the epidermis that they're taking. This is that hyperbaric chamber I was talking about. You can fit 2 patients in there. Sometimes we'll fit the nurse and 1 patient. Most of these times, most of the people that are getting these treatments, they'll have to come back for about 20 or 30 treatments every day for about 3 hours a day. You sit in this chamber, it pressurizes with air, you put a hood on that fills with oxygen, and you just breathe in this oxygen. So they're using that again for burns, for skin disorders. Joe Namath has been a big proponent of it for head injuries, football head injuries. They're starting to do research about that. There's even places you can go now to sit in a hyperbaric chamber for beauty treatments. If you want your eyes to look better or your skin to look healthier, I guess. I don't know. We don't do beauty treatments there, but there are some places around the city where I guess if you have some extra money and you want to try it, go for it. This is our tank room. This is where it used to be back in the day. Yes, go ahead.
I had a question. How long do
Yeah.
burn patients or the diving injuries? How long do they stay in the chamber?
About 3 hours.
3 hours.
Because it takes about a half hour to get them down a couple atmospheres, which would be about 60 feet below the water. That's the type of pressure. And then they'll stay at that pressure where the oxygen is getting deep into the oxygen or deep into the tissues. And then we'll slowly bring them back out. It takes about maybe another half hour, 45 minutes to bring them back up to regular atmosphere level. But yeah, good question. And that, again, that comes from the bins, which was all from the Brooklyn Bridge. When they were building that Brooklyn Bridge, late 1800s, guys were going down, they were sinking these big caissons down, and they would be coming up, these guys from digging dirt out of the caissons to lower it down below the water, be coming up all kind of hunched over and painful, and that was called caissons disease. And eventually they figured out that this was nitrogen, and they ended up terming it the bins, but that was all created here in New York City. Yeah, really interesting. So you might see some of these. Oh, let me talk about this room again. This is our tank room, our hydrotherapy room. It used to be, you hear these stories back, in the 70s and 80s where they would take these wire brushes and scrub these wounds and people would be screaming and stuff, just very painful. We don't necessarily do that anymore. It's a lot more gentle. We'll use some pain medicine. They would scrub, being the theory that the more you scrub that dead skin off, you want to scrub it until people can feel the pain, because then you know you're at good skin where you can actually graft onto it. But a little more gentle now. That was just causing too much PTSD for our nurses and the patients. But hopefully you don't end up in this room. You don't want to be in this room. I'm not trying to drum up business for the burn center. I'm trying to keep you guys out of there. So these are our splints. Again, I have a couple examples up here if you want to see. But again, you've probably seen some people wearing these burn garments or doing these splints like this. And it's very important that people do this rehab, because those scars will tighten up. And if you don't move around, you will end up frozen like that for the rest of your life. So we have a great team of occupational and physical therapists that work with people to, doing the large motor movements and the fine motor skills to make sure that people can regain their independence and get back to somewhat of a normal life. And then we have case managers and social workers that work with people, because imagine how stressful that burn is. I always say, especially for that 13-year-old girl who gets a burn on her face, how damaging that's going to be for the rest of her life. So we have huge support systems and great support groups. SOAR, S-O-A-R, that's Survivors Offering Assistance and Recovery. We have family groups that meet monthly. We have the Phoenix Society. They just had their big World Burn Conference over the weekend, and that's where they had about 1,000 burn survivors come from all around the world. And they come and hang out with each other, because who better to talk about a burn or teach people about a burn than somebody that's been burned themselves and have gone through it. So huge, yeah, it's great. I'm really proud of the work they do with that. So let's talk real quick about some burn first aid. Again, if you do get burned, you want to put cool water on it. Never ice. Ice is going to freeze that tissue. You never want to do any of those home remedies either. Eggs and butter and spaghetti sauce I've gotten, potatoes. People ask me about avocado. Like, you're not making a buffet. You're trying to cool this burn, right? Hello, come on in.
Oh, thank you.
Yeah, absolutely. Have a seat. And obviously, if it is a major burn, you want to call 911. Fire department will come. They'll take you to the ER. If it's a bad burn, you're probably going to end up going to the burn center. You can always request, if you are burned, that you come straight here to the burn center. If it's a small burn, though, if it's something minor and you want to have it checked out, you can come to our outpatient clinic. There's a number there. Have some stickers and magnets in the back as well with our number on it. So again, you want to use cool water. That's the best thing, running cool water. Remove any loose clothing, jewelry, anything like that. If you have clothing that is stuck to the skin, don't remove it. Just cut around it if you have to. Leave it there, because you're probably going to have a surgeon remove that. You want to run underwater for at least 10 minutes. Again, never use ice. If it's just a minor burn, you can take some Tylenol or ibuprofen to kind of just stop the swelling. Again, never pop those blisters. You can use a little bacitracin. You want to cover it with a clean cloth, something sterile, hopefully. Drink plenty of fluids. Come see us. Chemical burns, imagine all those things underneath your sink. Drano is especially bad. That's very caustic. There's acids and alkalis. You can get burned by that stuff all the time. All those people that are cleaning with chemicals and not wearing rubber gloves, they're probably going to end up getting burned. We get a lot of people like that all the time, putting bleach in the water, or they've got their hands soaked in bleach, and that causes a burn, a really bad one. Drano's really bad, though, because that actually attacks the fat cells. It liquefies them. And no matter how much water you keep putting on it, Drano is meant to keep working even in water. So it's very difficult to stop those burns. That's just copious amounts of water, maybe 20, 30 minutes of cool running water. But if you happen to go to the burn center, we want to know what chemical it was, how long were you in contact with it, was there any decontamination at the scene? Again, no home remedies. Some people even said, what about toothpaste? Toothpaste, it might feel kind of cool for a second, because of that menthol, but imagine what happens with toothpaste. Think about that. If you have it on your counter and you leave it out there, it just dries up really hard, right? And it's hard to kind of scrape off. Well, if you come to the burn center with toothpaste, all of you, now we're going to have to scrape that off. And so it's going to be even more painful. Egg whites, tomato sauce. That was one I heard. That was a new one to me. I had never heard that one. But yeah, all of these home remedies, They may have worked for some people in the past for some small burns, but really all you're doing is just kind of making a mess, and it's going to become infected. And you know, trust me, if spaghetti sauce worked, we'd be using it all day long over there. You know? Yes.
What if you have Silvadene at home?
Silvadene is good. However, Silvadene has to be recommended by a doctor. A doctor should show you how to apply it, a doctor or a burn nurse. Because a lot of times, the thing with Silvadene too is that it has silver in it. This is a cream, it comes in a little jar, maybe about this big, a blue jar. And sometimes you can buy it at Walgreens or CVS, but it has silver in it. And silver is an antimicrobial, it's a natural occurring antimicrobial, but it only lasts for about 6 hours. So about every 6 or 7 hours, you have to reapply that Silvadene. You have to take the dressing off, put it back on. If you put it on too thick, it can be damaging. If you put it too much around the wound, you can actually damage the good skin. So Silvadene is good. We still use it from time to time. There's better things out there that we use in the burn center. So if you are prescribed Silvadene, just make sure you talk to the doctor about how to properly use it, and they'll give you all the directions for it. But would I recommend just going out and buying Silvadene just for a burn? No, not necessarily. If you think it's bad enough for you need Silvadene, just come to our outpatient clinic and make an appointment, and we'll let you know for sure. So, and that's a good question actually. So we're always coming up with new things because we're a verified burn center. We're always on top of the new technologies. So it used to be that we basically use Silvadene all the time. Well, it was very painful for patients because, again, it only lasts for about 7 hours. You have to unwrap the wound. It could be all over their body. Unwrap them, scrub it all off, put new stuff back on, wrap them back up. It's just a lengthy process for the patient, a lot of pain. It was lengthy for the nurses. It cost a lot of money to pay burn nurses to do this kind of stuff. So the Army, about 2 or 3 years, or about 10 years ago, they came up with multi-day dressings. So there's all kinds of new dressings. This actually has silver in it as well. But sometimes we can put these dressings on and send the patient home for 2 or 3 days, tell them to come back to the clinic, or we can cover them up with this dressing and keep them in bed for 4 or 5 days in the ICU, and then 5 days later, then we'll take the dressings off and we'll take a look and see how they're healing. Instead of them having to do this 3 times a day, these dressing changes, now they do these multi-day dressings, which are really nice. So I have some samples up here if you guys want to see some of them. Some of the other new technologies we're using, we just started using this a couple years ago, but it's called ReCell. And this is actually skin cells that you can spray into the wound. So when you go into surgery and they take that piece of skin, they'll cut it up, they'll put it in these little vials that'll kind of break up, dilute it into skin cells. They'll put it out in a spray bottle and they'll actually spray that onto the wound. Amazing technologies, yeah, it's incredible. We have a new thing that we're using. It's a debrider. It's made out of pineapples, because when you eat pineapples, you drink pineapple juice, kind of get that funny feeling on your tongue. That's actually debriding the dead skin off of your tongue. And so in surgery, the surgeon's in there. Remember I said you have to cut away all that dead skin or else it'll become necrotic and the patient will become sick. So that's kind of just the surgeon eyeballing it. And so now they can use this pineapple debrider, which only attacks the dead skin, but it leaves all the live skin. So it's working on like a microscopic level to clean this wound out and get rid of all the dead skin. It's absolutely incredible. So amazing stuff. There's some other things out there. You guys may have heard about burn centers using fish skin. They use tilapia skin. That's actually a viable product. It's a viable technology where they can use fish skin to kind of put on that wound, let the wound bed heal. It'll start some skin growth. But we don't necessarily use that here. We have better technologies, basically. We have better dressings. A lot of third world countries still use the fish skin, but it does work. What else? Pig skin, that's another one as well. We were big proponents of the pig skin, but then of course you have different communities here, especially the Jewish community, and so we don't want to cross lines or get in trouble with anybody. So now we have, like I said, now we have these better dressings that work even better than pig skin or fish skin. So why not use the better ones? But yeah, so again, no home remedies and definitely no ice. Ice is really bad for you. So there's some brochures in the back. They have burn prevention tips on the front, fire prevention tips on the back. We'll just run through some of those real quick. Again, watch your coffee, your tea, your soup, and other hot liquids. I know it might be hard to see, but again, I have these on paper for you. Turn down your water heater. Be careful when you're cooking. When you're frying foods, you get the splattering all over the place. They have those little fry lids, these metal screens Sometimes there's silicone too. You can just put it right on the top of the frying pan. I have one at home. I use it all the time. It's great. You're not going to make your food all soggy, but it prevents all that grease from splattering all over the stove, which can catch fire and cause a fire. So again, we just want to prevent these fires, prevent these burns. Avoid bathing your baby in the sink. We talked about that. Get a fire extinguisher. Use caution when you're grilling and using gas. Never pour gas onto a fire. That flame will go right up the stream of gas and back into the gas can and explode. Let's see what else. Obviously, watch your kids around there. Don't put hot lids right behind somebody that's grilling. They may burn their leg. And in case of a fire, call 911. Get the fire department there as soon as you can. These guys, they get paid to drive in that truck and come see you, okay? They sit around in their firehouse all day, watching the game or eating food or something, So don't be afraid to call the fire department to have them come check it out. If something's suspicious, if you smell smoke, the rotten egg odor, that's gas. If you ever smell that, you open your door and all of a sudden your house smells like gas, get out. Don't turn on any lights. You want to get everybody out. Knock on the doors and tell your neighbors to get out because that can be very dangerous. We've had major explosions, building explosions because of gas. So be very careful. Somebody the other day, I was giving a presentation, and she said, well, winter's coming up. Can I heat my house at night by just turning on my stove? I said, oh, absolutely not. I do not recommend that. I said, spend the money, just get a little space heater. You can find them 20, 25 bucks. These new ones are really good. If they fall over, then they will just shut off automatically. Don't set it next to drapes or anything like that. Obviously, be smart about it. But can you imagine, though, if you're trying to run your stove at night, which plenty of people in this city do, unfortunately, they don't have a lot of money to pay for these heating bills, and so they'll run their stove, and there was a major fire in the Bronx because there was a pizza box sitting on that stove, and they didn't really realize it, or the pizza box fell over or something, caught fire, caught up in the cabinets, a couple of children died, family member died up in the Bronx. So serious stuff, and you just don't want to take that risk. Be risk averse. And if that flame went out, then all you just have is gas coming out of there. And your apartment can fill up with gas while you're sleeping. So be very careful. Again, it's fire prevention. You want to prevent this stuff. So last slide here, if you want to check this place out, I highly recommend it. It's the New York City Fire Museum. It's a great museum. It's down in Soho on Spring Street. It's a lot of fun. They have all the old fire apparatus. They've got all these really cool paintings, and George Washington's fire truck is down there, all this crazy stuff, so it's really fun. But they also have a learning center for children, so you can take the kids down there, and they have this little area set up, kind of like a play school apartment, like My First Apartment or something, and they'll fill this thing up with some fake smoke, and they'll teach kids how to stop, drop, and roll, and how to crawl out, and really great. They do a fantastic job down there, and so highly recommend if you're looking for something to do or take the kids to, take them down to the Fire Museum. It's great, the New York City Fire Museum. So thank you guys very much. I appreciate it. I hope you learned something today. Does anybody have any questions? No? All right. Well, thank you guys. I really appreciate it. Stay safe. If you have any other questions or anything you need, feel free to call us. Our numbers are on there. Take some of that information. Take a couple of those water bottles. Please have a good time. Thank you guys.
All right, thanks.
And thank you for letting me